Hello, this is Amy from Amostique Vet TV. The first video we'll be looking at today is covering leg fractures in cats. Firstly, we'll start off with talking about some of the common causes of bone fractures in cats. There is violent force. This is things like getting hit by a car, falling from a height, getting stepped on, getting attacked by a larger animal such as dogs. Then there is the fatigue fracture. This is usually from muscular contraction, so running for a long period of time causing stress to the limb and eventual fracture. And finally, spontaneous fracture. These are usually a result of existing bone disease, or they can be age related, usually in especially young or old cats. Next, we will look at signs of possible fracture in your cat, starting with them being in obvious pain, doing things like crying, difficulty in using the limb, not allowing that area to be touched. Then there is obvious signs of lameness, so putting little to no pressure on the limb. Also, there could be a deformity of the limb. This could be as simple as a shortening or lengthening of the limb, or something just like the limb looking a little abnormal in shape. Then there is the open fracture, where the bone will be sticking through the skin. Another sign is something called crepitus. This is where you will feel a crunching, crackling sensation in the area if you were to palpate it and move it around. The case study we'll be looking at is that of a 2-year-old female cat with a suspected foreleg fracture who was stood on by her owner. When the cat first comes into the surgery, it has to be safely removed from its carrier and then restrained for examination. A towel can be used to remove the cat from the cat carrier to reduce the risk of further injury to the cat and reduce the risk of the cat escaping. For the handler's safety, if necessary, muzzles may also be applied to the cat if it is trying to bite. If you look at the top corner, you can see an example of what a muzzle would look like. This cat has a foreleg injury, so she will be restrained in the sternal recumbent position, that is, on her stomach. We will also have her leg outstretched. To do this, the cat should be tucked under the handler's arm with a firm but gentle hold of the head, using either a C hold or, as in the picture below, a scruffing technique. The handler's other hand should support and hold the injured leg out for examination. Again, you can see this in the picture. Next, we will see what happens in the pre-op assessment. Cats are very good at hiding pain, so often an analgesia will be given to reduce any pain and distress the cat may be in. This will make the examination a much easier and safer process. Then, with the help of the vet nurse or animal nursing assistant, who will appropriately restrain the cat, like in the methods before, the vet will check the injury but also look for other injuries by performing a basic health check, like was shown in the previous video on the channel. They will be looking out for signs of shock, such as rapid breathing. They check this by observing the chest rising for 15 seconds, then timing the number it rises by 4. It should be between 20 and 42 breaths per minute, but they will expect it to be on the slightly higher side due to the stress and pain the animal may be in. Also, they will be looking for signs of internal bleeding. They do this by feeling the abdomen and checking for a distended bladder and any sort of pain and discomfort whilst it's being touched. When they are checking the injured limb, in this case the lower foreleg, the extremities below the fracture site should be checked for blood supply. They do this by assessing the warmth of the limb. They're looking for it to be warm to the touch. If the limb is cold, that is a sign of loss of blood supply, and this can be serious. They will also check the capillary refill time. They do this by pressing or pinching an area. They want it to go pale with the pressure and then come up pink again within a few seconds. They'll also look for excessive swelling. This is something called edema. And finally, digits will be pinched. So they'll pinch the pads of the paw to check if there's any sensation there. This cat has no obvious injuries, so the vet will then start the treatment process by administering fluid therapy via IV catheter to stabilise the cat. They will temporarily splint to stabilise the injury. Then they will take the cat for an X-ray to determine the severity of the break and decide the course of treatment to be taken. This the X-ray can be performed by either the vet or a registered vet nurse. Methods of treatment. Here we'll take a quick look at the usual methods of treatment for leg fractures by vets. Firstly, there's cage rest for minor breaks. Then there is splinting of the injured limb so it can be immobilized. There is surgery for more severe fractures like open fractures or shattered bones, for example. This is where like the bones will need to be pinned and things from surgery. And lastly, the most severe cases would be amputation of the limb. The X-ray on this cat confirmed it has a break that requires surgery to fix it. Before surgery, the vet must obtain a full patient history from the owner, including things such as age, general health prior to the accident, any current illnesses or medications, as these could impact on anaesthetics and the treatment. The cat must then be weighed in order for the correct dosage of analgesia and anaesthetic can be calculated. The patient must continue to be stabilised with ongoing fluid therapy and analgesia to keep it comfortable. Unless it is a very, very urgent case, the surgery will not be performed immediately. Instead, food should be withheld from the patient for 8 to 12 hours prior to the surgery to ensure the stomach is empty to avoid risk of aspiration. This means it may vomit and inhale it. Water should be withdrawn no more than 2 hours prior to the surgery, though. Ideally, an IV catheterization should be in place before surgery. The Protection of Animals Act 1954 means any surgery that may cause pain to an animal must be performed under an anaesthetic. For the surgery, a vet nurse will be tasked with assisting all aspects of anaesthesia, including monitoring the patient through the surgery and its recovery. Before they begin the anaesthesia, they ensure the cat is adequately sedated with a pre-anaesthetic sedative via an IV injection. After this, an induction anaesthetic is administered, and once that is done, the cat is then intubated with an endotracheal tube. This is a tube down the throat into the lungs. This will administer both oxygen and anaesthetic gas via the anaesthetic machine. You can see pictures of all this equipment on the page here. While the vet performs the surgery, a vet nurse will monitor the cat's vital signs to check the health of the patient throughout. This allows for adjustments in the anaesthetic to be made if required. The picture shows what a typical veterinary theatre would look like and the typical monitoring equipment used. This includes an ECG machine to show the rate and pattern of the heartbeat, a heart rate monitor to measure the number of heartbeats per minute, blood pressure monitor to measure the systolic and diastolic blood pressure, a respimeter to measure the number of breaths per minute, and a pulse oximeter to monitor the amount of oxygen in the patient's blood. After surgery, the leg would need to be bandaged. This is often done by the vet nurse. Pictured here are the types of bandages usually used. There is gauze dressing, which is for wounds, cotton wool, which would be placed between the toes for comfort and to stop it rubbing and them getting sore, a padded bandage, again to pad the area, conform bandage, this is to hold all the other bandaging in place nice and firmly. And then finally, the top layer would be a cohesive bandage, and this is to support and immobilize the limb, as well as helping to hold all the other bandages in place. When dressing the leg after surgery, the surgery site should be covered with a sterile wound dressing. After that, start with cotton wool between the toes. This is to make it more comfortable and prevent sores between the toes. The next layer is the padding bandage, and they use a technique called the 50-50 wrap technique, where you cover 50% of each layer of the bandage, ensuring to go above the joint that is above the break. The next layer is the conforming bandage. This will hold the padding in place and also help and add a little bit of pressure, again using that 50-50 technique. And the final layer is a cohesive bandage, and that will hold all the other bandages in place and support the limb Again, that uses a 50-50 technique and keeping it fairly taut. It's quite a stretchy bandage, but ensuring it's tight, but not so tight that it will restrict blood flow. A simple test to make sure this is right is being able to place two fingers comfortably but snugly down the inside of the bandage. You can see a picture of that in the diagram. It takes between 6 to 12 weeks for an adult cat to recover from a fracture if there are no post operative complications. Some cats may initially require a cat collar as they may not like the bandage on their leg and try and chew it and things. They will need cage rest initially, and then regular vet checks and dressing changes will also be needed.